it was wonderful to work with the patient experience team so that they could really explain to us how an advisor could work in our capacity. So then Vince and Shanta have been with us again for about 18 months now, and they are part of our Quality and Patient Safety Committee. And that's a committee that we have established in the Fertility Clinic that reviews processes, patient and safety, initiatives, concerns. And it's lovely to have our patient advisors sit at that committee table with our multidisciplinary team of nurses, doctors, administrators, lab personnel, and just really dive deep into what it is we're looking to do for our patient, and to have their lens at the table is quite wonderful. Vince is one of our patient advisors who is quite the advocate in the community. Currently, Vince is the facilitator of the Southwestern Ontario Donor Conception Support Network, and so he's able to bring that unique lens when he comes back to the table and sits with us at our quality committees. He's able to bring the perspectives and the experiences that people who have had help and assistance in terms of donor conception support, and bring that lens to the table, which is wonderful. We've been very fortunate with Vince and with Shanta, but with Vince, through his patient advisor role with the Fertility Clinic, he's seen how it can make an impact, and he's actually started working within the women's health program at London Health Sciences Centre to further his knowledge and his experience and to offer his support.
We all experience healthcare. We all use the hospital system. We rely on it in order to stay healthy and to fix problems that come up. We have an opportunity to participate and make a contribution, to create space where decisions at the hospital are being made with the consideration of a patient perspective. All the healthcare professionals that I work with at the hospital in my volunteer work are concerned to deliver great healthcare. As practitioners, they're often focused on the process or the procedure, the requirements, what needs to be done to deliver that healthcare. Where patient advisors play a role is we have that opportunity to help them expand their decision space, to create a better decision that consciously considers the patient perspective. Each of us, if you reflect on it, we've had experience with the hospital system, so you're qualified to comment. You don't have to have had lots of experience, particularly bad experience or particularly good experience. As a patient, you have an experience and you bring a perspective. And if you look at it as just making space for the professionals to consider that larger context of their decisions, then any of us can do that.
And it's wonderful to see the plethora of patient advisors that are at LHSC, and it's wonderful for us to have two within our fertility clinic. And it is great to see that their voices are being heard across the organization in terms of new policies, in terms of new procedures, even in terms of having patient advisors provide interview questions when you're interviewing new nursing team members or new administrators. It's wonderful to have their voice in really surrounding everything that we do.
I think that if you care about helping to improve the quality of healthcare that we're all receiving, if it matters to you to make a difference in your community, and if it matters to you to influence the decisions that are being made that will affect the care you're going to receive at some point, living here in London, and the care your family and friends are going to receive, if that resonates with you, you should call the patient advisor office.